I think there's two main pieces of advice I would like to reflect on, and the first one really relates to not underestimating the complexity of healthcare systems and the complexity of what it is to deliver care for patients. And that gives a sense of humility in terms of really, what are the measurements able to tell us about the system and how it works. And I think that's very important to gain the respect of clinicians, to gain the respect of managers, to really understand that complexity and not think that simplistic measurement will be a reflection of such complex systems. And this also, really gave me the impetus to try to refine the measurements and not accept, the limitations of previous measurement. And that's something that I'm constantly pushing in this organization. We need to make those measures a better reflection of the complexity of the system and the challenges that it faces. So I think that's one key pieces of advice that I've tried to follow. And the second one is really to try to listen to people. Listen to what the staff says, listen to what clinicians are saying, because there's always a lot of knowledge embedded in systems. And this never gets published in the academic literature. It doesn't get published in a report or whatever, but there's knowledge that's embedded in the system, and if you don't listen, then you will never capture it. And therefore, you might base your own decisions as a leader on only a partial view of how things are really. Again, I think it relates to this understanding that measurement can be a very simplistic reflection on how things are, and if you're not listening, then you are preventing yourself from sometimes being responsive and reactive in very important circumstances. And leadership in the end is about to be followed, about to have an impact on many people. And if you don't develop that credibility by listening to people, it's really hard to be in a position of leadership where it will really mobilize people.